Good day everyone, my name is Mary Rose Ambalingid from Nueva Ecija University of Science and Technology under BSN 3G. So for today, I will be demonstrate for a nasogastric tube insertion. For the assessment, we need to assess the doctor's order, the client's level of consciousness and level of knowledge and understanding, availability and functionality of needed materials, also check for history of nasal surgery or deviated septum, assess the patency of nares, determine the presence of gag reflex, and lastly, assess the mental status or ability to participate in the procedure. For the planning, before inserting a nasogastric tube, determine the size of tube to be inserted and whether the tube is to be attached to suction. Prepare equipments, large or small bore tube, non-latex prepared. Non-allergic adhesive tape, 2.5 cm, 1 inch wide. Clean gloves, water-soluble lubricant, facial tissues, glass of water and drinking straw, 20 to 50 ml syringe with an adapter, basin, pH test strip or meter, bilirubin dipstick, stethoscope, disposable pad or towel, clamp or plug, optional, anti-reflux valve for air vent in phlegm sump tube is used, suction apparatus, safety pin and elastic band, and for the lastly is the CO2 detector for optional. For the implementation, introduce self and verify the client's identity using agency protocol. Explain to the client what you're going to do.
Joanna. So, ma'am, this procedure is for inserting NGT tube and it will be uncomfortable. But if you wish me to stop, just raise your hand or tap me, okay? I will prepare the equipment.
Assist the client to a high Fowler's position if his her health condition permits, and support the head on a pillow. Place a towel or disposable pad across the chest. Perform hand hygiene and observe appropriate infection control procedures. Provide for client's privacy, assess the client's nares, prepare the tube, support the patient during the procedure, and lastly, determine how far to insert the tube. Use the tube to mark up the distance from the tip of the client's nose to the tip of the earlobe, and then from the tip of the earlobe to the tip of the xiphoid. Mark this length with adhesive tape if the tube does not have markings. Lubricate the tip of the tube well with water-soluble lubricant or water to ease insertion. Insert the tube with its natural curve toward the client into the selected nostril. Ask the client to hyperextend the neck and gently advance the tube toward the nasopharynx. If the client gags, stop passing the tube momentarily. Have the client rest, take a few breaths, and take a sip of water to calm the gag reflex. Ascertain correct placement of the tube, aspirate stomach contents, and check the pH, which should be acidic. Confirm by X-ray. Place a stethoscope over the client's epigastrium and inject 10 to 30 ml of air into the tube while listening for a whooshing sound. Secure the tube by tapping into the bridge of the client's nose. For evaluation, evaluate the patient's response to the procedure and document the procedure and other important data on the client's chart.